Frailty is a condition that gets more common as people get older. And what it means is that they're vulnerable to common stresses. Common stresses can have a bigger consequence for them. So what I say to them is, what happens to them as frail is that we have to be very careful with them, because sometimes even the equivalent of a puff of wind can blow them over. So we got to make sure that we strengthen where we can and we minimize the things that would give them harm. So we need to act on frailty now, and the reason is clear. It's simple math. People begin to age roughly at about the age of 15. What happens before that is called development. And they accumulate deficits at the rate of 4.5% per year, clinically evident ones. So when you're 15 years old, you've got nothing wrong with you. You double that, and at age 30, you still got nothing wrong. But for most people in Canada, the last of the doubling times they will have will be between the ages of 75 and 90. And in 2021, the leading edge of the baby boom began to turn 75. So if you knew nothing about frailty, but you started to assemble, when do we see the sharp takeoff in the number of new cases of hip fracture? It's age 75. When do we see the sharp takeoff in the number of new cases of dementia? Age 75. When do we see the sharp takeoff in the number of people with congestive heart failure or recurrent admission for COPD or a host of other problems? It's age 75. This is not by coincidence. This is how aging works. And up till now, we tried to approach this by having people really good at hip fractures, whom we greatly need. And then people get heart failure, and we greatly need that too. And we need each of these things, but we need people who can put that together and who are happy to handle many of the problems themselves with their teams and not send patients to endless rounds of appointments with people who can do one small part of things.